So in this video we will talk about the transplant rejection. So there are various transplant rejection we are going to talk in this video. Those transplant rejection are hyperacute transplant rejection, acute transplant rejection, chronic, and graft versus host disease. So these are the four types of transplant rejection we are going to talk in this video. So let us start from the hyperacute transplant rejection. I'll discuss one by one each and every one from the onset, pathogenesis, and the various features we see in the transplant rejection in each type. So let us discuss about the hyperacute transplant rejection. The hyperacute transplant rejection occur within minutes after the transplant. So what happened? There is cross linking between the recipient antibody and the donor antigen. What happens is that the pre-existing recipient antibody react with the donor antigen. So it is the type 2 hypersensitivity reaction. So this pre-existing recipient antibody that reacts with the donor antigen activates the complement. So the various features we see in the hyperacute transplant rejection are the widespread thrombosis of the graft vessel. So widespread thrombosis of the graft vessel will lead to the ischemia or the necrosis of the graft. So the only treatment option that we see in the hyperacute transplant rejection is the graft should be removed immediately. Now let us discuss about the acute transplant rejection. The acute transplant rejection can occur after weeks to month. So here happen there are two components. One is a cellular component and another is the humoral component. In the cellular component, type 4 hypersensitivity reaction occurs. In the cellular, what happened? CD8 plus T cells or the CD4 plus T cells are activated against the donor MHC. So it is the type 4 type of hypersensitivity reaction. It is the cellular type. And the humoral type, it is similar to the hyperacute except the antibodies developed after the transplantation. So the features we see in the acute transplant rejection is that there is the vasculitis of the graft vessels, and the vasculitis of the graft vessel with the dense interstitial lymphocyte infiltration can be seen in the pathology. So to prevent or the reverse this acute type of transplant reaction, we should give the immunosuppressant to the recipient. So now let us talk about the chronic transplant rejection. The chronic transplant rejection can occur in months to years after the transplantation. So the chronic transplant rejection can include both type 2 and type 4 hypersensitivity reaction. What happens? I'm going to explain you. The CD4 plus T cell are T cells respond to the recipient antigen presenting cells. So it presenting the donor peptides including the allogenic MHC. So the both cellular and humoral component are involved in the chronic transplant reaction. Thus it includes the type 2 and type 4 hypersensitivity reactions. The features we see is that there is proliferation of the vascular smooth muscle, there can be the parenchymal atrophy, and the interstitial fibrosis can be seen in the transplant rejection. So what we see that the graft is dominated by the atherosclerosis. The organ specific example can be given as the chronic allograft nephropathy, bronchiolitis obliterans, accelerated atherosclerosis, which is seen in the heart, and vanishing bile duct syndrome. Now let us discuss about the graft versus host disease. So the onset varies in the graft versus host disease. You can see is that it is the type 4 hypersensitivity reaction that occurs in the graft versus host disease. What happens is that the donor T cells is immunocomponent and the host is immunocompromised. Usually the donor components, the transplant organ which the donor has is rich in the lymphocyte, and if the host is immunocompromised, the donor T cells proliferate and the reject host cell with the foreign protein. This leads to the severe organ dysfunction. So the features we can see in the graft versus host disease is that there could be the maculopapular rash, jaundice, diarrhea, and hepatosplenomegaly can be seen. So if the patient is immunocompromised, we should irradiate the blood product prior to the transfusion to the recipient to prevent the graft versus host disease. So this much for the topic of the transplant rejection, we discuss about the hyperacute, acute, chronic, and graft versus host disease. We discuss their various onset, pathogenesis, and features. I hope you understood this video on the topic of transplant rejection on the immunology chapter of the immune responses. Thank you.